Okay, so we are tackling a pretty huge topic today, the history and theories of mental health.
It's a big one for sure.
It is, and I have to say, just looking at all this reading material, it can feel a bit overwhelming,
Yeah.
especially for you nursing students out there. I mean, you guys have so much on your plates already.
Oh, absolutely.
So what we're going to do is kind of a deep dive, right, through the centuries and try to unearth the most fascinating and really the most relevant points from this mountain of knowledge. Would you agree with that?
I think that sounds like a great approach.
Yeah,
Yeah,
because
no
we've got
problem.
we've got everything from ancient beliefs about mental illness being caused by like lost souls and witchcraft
Right.
to Hippocrates and the four humors,
Yeah.
the mental health continuum, Maslow's hierarchy of needs.
Yep.
It's a lot.
It is a lot.
So what to you is the most um, kind of striking thing about the history of mental health care?
Well, it's really a fascinating journey, isn't it? Going from these very ancient beliefs about lost souls and demonic possession as the causes of mental illness to more sort of biological models and then into the 20th century and beyond. With the advent of psychopharmacology and all these other advances, it's remarkable to see how far we've come in terms of our understanding of mental health. But also, I think it's striking to think about how much we still don't know. There's still so much that we're learning about the brain and about how it works and how that relates to mental illness. But, to your point, one of the things that I find really striking is um, how much our perceptions of mental illness have been shaped by the prevailing cultural beliefs and societal norms of each era.
It makes you wonder, right? Like how much of what we believe now will seem, completely outdated or maybe even barbaric.
I know, right? Like imagine trying to explain, anxiety or depression to someone who truly believes that mental illness is caused by demonic possession. It's just a completely different framework for understanding the world and how it works.
Totally different. So let's actually start there, like at the beginning with those really ancient perspectives on mental illness,
Okay.
because like you were saying, we've got all these wild ideas about lost souls, witchcraft. I mean, it sounds like something out of like a horror movie.
It does, and it's interesting because I think, those early beliefs, they really reflect a fear of the unknown, right? When people didn't understand something, especially something as complex as the human mind, they often turned to the supernatural to try to explain it.
Makes sense.
But what's really significant, I think, from a historical perspective is the shift that happened with Hippocrates, right? Because he was one of the first to propose that mental illness had biological roots. Specifically, he believed that it was caused by imbalances in the body's four humors, right? Blood, phlegm, yellow bile, and black bile.
Oh, yeah. Okay, so for those listening who maybe didn't get a deep dive on the four humors in their intro to medicine courses,
Okay.
could you break that down a little? Like what was the thinking there?
Yeah, so the idea was that these four humors needed to be in balance for a person to be healthy, right? And an excess of one or a deficiency in another was thought to cause all sorts of illnesses, including mental disorders.
Okay.
So, for example, too much black bile was believed to cause um, melancholia,
Melancholia.
which is what we would probably call depression today.
Oh, interesting.
And so the treatments were based on trying to restore that balance.
Yeah.
So if you had too much blood, for example, you might be treated with bloodletting.
Wow.
So it's a far cry from our modern understanding of mental illness.
Yeah. So instead of looking for a supernatural cause, he's looking at, the body itself as a potential source of the problem.
Yes.
That's a pretty radical shift for the
That's
time.
huge. Yeah. And his ideas actually held sway for centuries. They influenced medical practice throughout the Middle Ages and even into the Renaissance.
That's amazing how these early theories, even if they seem outdated now,
Yeah.
they really, in a way, laid the groundwork for how we think about mental health now.
Oh, absolutely. And I think it highlights, the importance of always questioning our assumptions
Right.
and being open to new discoveries.
Right, because who knows what we'll discover in the next 100 years
Yeah.
that'll make our current understanding seem totally off base.
Exactly.
Now it's interesting though, like you said, different cultures have had really different approaches to mental health care,
Yeah.
and it's fascinating how some cultures were really ahead of their time in some ways. So we've got Europe in the throes of the Dark Ages,
Yeah.
and meanwhile over in the Middle East, they're establishing the first asylums, right?
Yeah.
Which is a pretty striking
It
contrast.
is. It's really striking. And I think, in the Middle East, there was a greater emphasis on compassion and providing refuge for those suffering from mental illness. They even had physicians who specialized in mental health care.
Really, so they had people whose entire job it was to think about, okay, how do we help people who are struggling with these things?
Yeah. And it's not to say that, there weren't challenges there,
Sure.
but there was definitely a different approach.
So while folks in Europe are blaming witches, the Middle East is offering a more what would you call it, like a more humane
Yes.
approach to mental health care.
Absolutely. And it just goes to show, I think, that, progress isn't always linear.
Right.
And that different cultures can have vastly different views on mental illness. And I think, as healthcare providers, it's important to be aware of those cultural differences and to be sensitive to the beliefs and values of our patients.
Absolutely.
Yeah.
And it's a good reminder too that even though we've come a long way, there's still so much we can learn from other cultures
Yeah.
and other ways of approaching mental health.
Right.
Now let's shift gears a little bit and fast forward. Let's go to colonial America, because I was reading that during that time caring for the mentally ill was often left to families to handle.
Right.
And if you didn't have that family support, things could get pretty grim, huh?
Yeah, it's true. I mean, without a strong family network, individuals with mental illness might end up in, prisons or poorhouses or even auctioned off as laborers,
Wow.
which is, a far cry from the compassionate care that we strive for today. But yeah, I mean, there was really no formal system in place for caring for the mentally ill.
Right. Okay. And then enters Benjamin Rush,
Hmm?
who's often hailed as the father of American psychiatry.
Right.
And it sounds like he really did advocate for more humane treatment of the mentally ill, which is great. But then some of his methods were, well, we'll just say a bit intense.
Yeah. Yeah, he was definitely a complex figure.
He was.
On the one hand, he really did promote ideas like treating people with mental illness with dignity and respect.
Yeah.
But on the other hand, he also promoted some treatments that we would now consider to be pretty barbaric, right? Like bloodletting and purging.
Yeah.
And even this device called the tranquilizing chair.
The tranquilizing chair. What in the world was that?
Yeah. It was essentially a form of restraint where people would be, strapped into this chair.
Oh my gosh.
And the idea was that it would calm them down. But I think, we now recognize that these practices were often more harmful than helpful.
Right. It's such a good reminder that even when people have good intentions, the care they provide can have unintended consequences.
Absolutely.
And that our definition of what is humane and what's ethical is constantly evolving, right?
Absolutely. And I think that's why it's so important for us as nurses to stay informed, right? To
Yeah.
stay up to date on the latest research and best practices.
And to always be, questioning and challenging our own assumptions
Absolutely.
about what's best for our patients. Well, speaking of good intentions, let's talk about Dorothea Dix, because here's this remarkable woman who's, she spearheaded this whole movement for state mental asylums in the 19th century.
Right.
And her goal was to create these specialized institutions
Yeah.
that would provide more compassionate care than, what was available in the overcrowded prisons and poorhouses of the time.
Yeah. Dorothea Dix's work was truly
It
groundbreaking.
really was.
I mean, she traveled all across the country, documenting the deplorable conditions that people with mental illness were living in.
Really?
Yeah. And her advocacy led to the establishment of dozens of state-funded asylums.
Which is incredible.
It's a real testament to her dedication and her compassion.
Really is. But, as we know, those asylums eventually, they became overcrowded and underfunded.
Right.
And the conditions, they deteriorated.
They did.
It seems like, kind of a classic example of even when you have these best laid plans,
Yeah.
if there's not that ongoing support
Right.
and resources,
Yeah.
things can really, really go wrong.
I think that's a really crucial point, is that, systemic change requires more than just, good intentions, right?
Yeah,
It
yeah.
requires sustained funding,
Right.
adequate staffing, and a commitment to ongoing evaluation and improvement.
It's like planting a seed but then forgetting to water it. And unfortunately, it feels like that legacy of underfunding and inadequate resources.
Yeah.
It's something that we still see even today
Absolutely.
in mental health care.
It's a major challenge. Yeah.
But, despite those setbacks,
Yeah.
you can't deny that the 20th century saw some pretty major breakthroughs in the field of mental
Oh,
health,
absolutely.
wouldn't you say?
Absolutely. I mean, the passage of the National Mental Health Act in 1946, that was a game changer.
Right.
Because it provided federal funding for research, for
Yeah.
training mental health professionals,
Right.
and for expanding community-based mental health services. So that was really a pivotal moment.
Huge.
Yeah.
And then, of course, you can't talk about breakthroughs without mentioning the discovery of antipsychotic medications in the 1950s.
Okay, before we go any further, I think we need to bring in our special guest expert to talk about antipsychotic medications.
Because this is complex stuff.
It is.
And I know our listeners appreciate, a clear explanation of how these medications work.
Right.
So, welcome to the show, doctor.
Yes.
Can you tell us a little bit about these medications? Like how do they work? What do they do?
Special guest expert.
Sure. So antipsychotic medications, sometimes called neuroleptics, they basically work by blocking dopamine receptors in the brain. Okay, special guest expert, dopamine is this neurotransmitter, and it plays a role in lots of different functions, including movement, emotions, and thinking. Okay, special guest expert. And so in conditions like schizophrenia, there's this thought that there's like an overactivity of dopamine in certain parts of the brain. Special guest expert. And antipsychotic medications help to regulate that activity. So they're basically like calming down the overactive parts of the brain.
Special guest expert.
Exactly. That are causing, the symptoms of psychosis. But special guest expert, exactly. It's like turning down the volume a little bit. Okay.
Yeah.
Okay, so that makes sense. Now, are there different types of antipsychotic medications? Special guest expert. Yes, there are. There are two main types. The typical antipsychotics, which have been around longer, like haloperidol or chlorpromazine.
Special guest expert. And then there were the atypical antipsychotics, which were newer, like risperidone, olanzapine, and quetiapine. Okay, and what's the main difference between those two types? Special guest expert. So the typical antipsychotics, they're really effective at treating the positive symptoms of schizophrenia, like hallucinations and delusions. Okay, special guest expert. But they can also cause some significant side effects. Special guest expert. Yeah, particularly movement disorders. Oh, wow. Special guest expert. The atypical antipsychotics, they're generally better tolerated, and they may also have some benefits for the negative symptoms of schizophrenia, like apathy and social withdrawal. Oh, interesting. So it's not just about quieting the voices or the delusions, but it's also about helping people re-engage with life.
For guest expert, exactly.
And with their emotions. Special guest expert, exactly. That's fascinating. Thank you, doctor, so much for breaking that down.
Yes, thank you. That was really helpful.
I think our listeners really appreciate your expertise.
Absolutely.
So these medications really did mark a turning point, wouldn't you say, in how we approach treating really serious mental illnesses.
Absolutely.
Like schizophrenia.
I mean, it really was a paradigm shift. Before the advent of these medications, the prognosis for people with schizophrenia was pretty bleak. I mean, many people ended up spending their lives in institutions.
Right.
But with the discovery of these medications, people could finally start to manage their symptoms and live more fulfilling lives.
Yeah, and it really kind of set the stage for the next big shift, right?
Yeah.
Which was this move towards community mental health.
Exactly.
Which, the 60s and 70s, we see this rise of this movement.
Right.
That really aimed to move people out of those large, kind of institutionalized settings.
Right. Yeah.
And back into their communities.
Right.
And the thinking was that people would fare better if they could live and receive treatment in their own communities, surrounded by their friends and their family and their support systems.
Absolutely. It was a really noble goal.
It was.
But unfortunately, the execution didn't always match the vision.
Right. And so we see, this deinstitutionalization, as it was called, really led to the closure of many state hospitals.
Right.
But without adequate funding for community-based services.
Right.
And that was kind of the problem.
That was the problem.
A lot of individuals with mental illness, they ended up homeless.
Right.
Incarcerated.
Yes.
Or just really struggling to access the care that they needed.
It's a really unfortunate example of how, even when we have good intentions,
Right.
if we don't think through the practical implications, the unintended consequences can be really, really devastating.
Absolutely. And it's a lesson that I think, we're still grappling with today
Yes, for sure.
as a society.
Yeah.
But despite those challenges, the community mental health movement,
Mm.
it really did pave the way for a more, what would you say, like a more holistic approach to care.
I think so, yes. It really did. And I think it helped us recognize that mental health is not just about, treating symptoms,
Right.
but it's about supporting individuals in all aspects of their lives.
Right. And about really kind of looking at the whole person, not just the diagnosis or the symptom.
Exactly. It's about, recognizing the individual's strengths,
Yeah.
their support systems, their
Yeah.
unique needs.
And that brings us to a kind of an important question, right? Like what is mental health?
Right.
It's not just the absence of illness, is it?
It's not.
No.
No.
So how do we even begin to define, what it means to be mentally healthy?
Well, I think that's where, Maslow's hierarchy of needs comes in.
Right. Yeah.
His model, it's a classic for a reason, right? Because it highlights that basic needs like food and shelter and safety, those needs to be met before a person can even begin to think about higher level needs,
All right.
like self-actualization.
It's like building a pyramid.
Right, exactly.
You need to have that solid foundation at the bottom.
Yes.
Before you can even think about reaching the top.
Mhm.
But how does that relate specifically to mental health?
Well, I think about it this way. If someone is struggling to meet their basic needs,
Right.
right? Like if they're, homeless or hungry or living in fear, it's going to be really, really difficult for them to focus on their emotional well-being
Yeah, I can see that.
or on their personal growth.
They're in survival mode.
Exactly. Their
Right.
energy is going to be completely consumed with just surviving.
Yeah.
So Maslow's hierarchy, I think, really emphasizes that mental health is intertwined with all aspects of a person's life.
Yeah.
And that addressing those basic needs is really essential for overall well-being.
That makes perfect sense. But Maslow's hierarchy is a pretty broad framework.
It is.
Are there more specific ways to think about, okay, what makes a healthy mind? Like how do we know if someone's, not just surviving but thriving in terms of their mental health?
Yeah, that's a great question. And I think, Maria Jahoda, she's a social psychologist. She actually developed 6 indicators of mental health that I think provide a more nuanced perspective.
Okay, I'm intrigued. Tell me more.
Yeah. So she argued that a healthy mind exhibits 6 key characteristics,
Okay.
which are a positive attitude toward oneself,
Okay.
self-actualization and growth,
Okay.
autonomy and independence, accurate perception of reality,
Mm-hmm.
environmental mastery,
Okay.
and positive relationships.
So it's not just about being, not sick.
Right.
It's about having, a positive outlook,
Yeah.
a sense of purpose,
Right.
the ability to connect with others,
Yeah.
and a realistic view of the world.
Exactly. It's about thriving.
Thriving, I love that. That's such a much more kind of empowering
It is.
way to think about mental health. And
Yeah.
it's helpful as nurses, I think, to have those concrete indicators in mind
Right.
when we're assessing our patients' well-being.
Absolutely. And I think it's a good reminder, too, that mental health is not a destination.
Right.
It's a journey.
It is a journey.
Right.
Yes.
And there's going to be ups and downs and challenges and triumphs along the way.
Speaking of challenges, let's talk about stress and loss.
Okay.
Because these are universal experiences.
Yeah.
That can have, a really profound impact on mental health.
Yeah.
And I think as nurses, we need to understand how people cope with those inevitable hurdles.
For sure. Because, stress and loss, they're a part of the human experience,
Yeah.
but they exist on a continuum.
Right.
So a little bit of stress, can actually be motivating.
It can be.
It can help us, meet deadlines, but too much stress
Right.
can be overwhelming and can lead to, anxiety or even burnout. And similarly, grief is a natural response to loss.
Uh-huh.
But if it becomes prolonged or debilitating, it can really develop into more serious mental health concerns.
So the question is, how do we as nurses recognize, when someone's struggling to cope with stress or with loss in a healthy way? Like, what are the red flags we should be looking out for? What are the things we need to be paying attention to?
That is a great question, and that's actually a question that we're going to delve into much more deeply in the next part of our deep dive. We're going to explore the different levels of anxiety from mild to severe,
Right.
and talk about how to assess a patient's level of distress. And then we'll also talk about the stages of grief and how to support individuals as they navigate this really complex process.
This has been incredible so far. We've covered so much ground from ancient beliefs
Yeah.
to modern concepts.
Yeah.
And I, for one, am really excited to continue exploring these nuances of stress and anxiety and grief
Yeah.
in our next segment. But for now, we're going to take a short break. So stay tuned for part two,
Yes.
where we'll really get into the nitty-gritty of how to assess and how to support individuals who are facing these really common but really challenging experiences. So we'll see you back here in a few.
Sounds good. Welcome back to our deep dive into the world of mental health.
All right. So as promised, we're gonna really unpack these two experiences that are pretty much guaranteed in life, right? Stress and loss. We've all been there, haven't we?
I think it's safe to say we all have at some point. And for nursing students, understanding how these experiences can impact mental health and how people cope, it's essential knowledge, really.
Yeah, for sure. So let's start with stress. I think we all kind of know, or at least we've heard, a little stress can actually be good for you, right? It can keep you motivated, help you meet those deadlines.
Right, that's the good stress, right?
Yeah, the good stress. But where's the line,
Hmm.
right? Where's the line between that healthy stress that keeps us going and the kind that really starts to, mess with our mental well-being?
Well, that's where this concept of the mental health continuum becomes really helpful.
The mental health continuum.
Yeah, it's the spectrum,
Yeah.
with adaptive responses on one end
Okay.
and maladaptive on the other. And it's not about labeling people as healthy or ill, but more about understanding where they fall on this continuum at any given time.
Okay, so walk us through that. What are some examples of those adaptive responses to stress? The stuff that helps us cope effectively.
Well, think problem solving,
Okay.
right? Like breaking down a challenge into those manageable steps,
Right.
or seeking support from friends or family or mentors.
Right.
Even things like exercise or relaxation techniques, or engaging in hobbies. These are all adaptive ways to manage stress.
Right. They help us kind of stay resilient,
Yeah,
right?
exactly. They build resilience. Yeah.
So what happens when those coping mechanisms, like, they're just not enough? What does it look like when someone starts slipping into that maladaptive zone? What are some of the warning signs, I guess?
Well, that's when you start to see, behaviors that maybe provide temporary relief,
Okay.
but ultimately they're harmful to their mental health.
Yeah.
Right.
Makes sense.
Substance abuse is a classic example, of course.
Yeah.
Or social withdrawal,
Right.
where someone's isolating themselves instead of reaching out to others for support.
Right.
Even things like, procrastination or denial can become maladaptive if they prevent someone from actually addressing the root cause of their stress.
Right. So as future nurses, what we're really looking for is not just the presence of stress, but how are they coping with that stress, right?
Exactly.
That's what's going to tell us where they are on that continuum.
It is.
And that's what's going to help us figure out, okay,
Yeah.
what are the right interventions here?
Exactly. It's about recognizing patterns.
Right.
And understanding the individual's unique response to
Yeah.
their circumstances.
Okay, so let's zoom in on a specific manifestation of stress here, anxiety.
Okay.
And I know the source material we're looking at kind of breaks it down into these different levels.
Yes.
Right. Mild, moderate, severe, and panic.
Right.
Why is it so important for nurses to understand these distinctions? Like, why do we need to get that granular with it?
It's all about tailoring our interventions.
Mhm.
Each level presents differently, right, with its own signs and symptoms.
Right.
And those dictate how we, as nurses, should approach the situation.
Gotcha. So think of it like a ladder,
Mhm.
right? Each rung representing a different level of anxiety,
Yeah.
and we need to meet the person where they are on that ladder.
Yeah, I like that analogy.
Okay, so let's climb that ladder. Let's start with mild anxiety. What does that look like? How might we approach that as nurses?
So someone with mild anxiety might just be a little bit restless
Okay.
or having trouble concentrating.
Okay.
Maybe they're a bit more irritable than usual,
Okay.
or having some slight physical symptoms like a mild headache or an upset stomach.
So they're still functional,
Yeah,
but maybe not at their best.
exactly. They're not quite firing on all cylinders.
Right.
But they're managing. And at this level, simple interventions can be really effective.
Like what? Give us some examples.
Well, things like an active listening, just really being present with them, providing reassurance,
Okay.
and maybe suggesting some simple relaxation techniques.
Yeah, makes sense.
Like teaching them some basic deep breathing exercises
All right.
or encouraging them to, take a break and engage in a calming activity.
Right, right. So kind of meeting them where they are and giving them some basic tools to kind of manage that mild anxiety.
Exactly.
Okay, but what if those initial strategies they're just not cutting it?
Uh-huh.
What happens as anxiety kind of escalates to that moderate level?
Well, now you start to see more pronounced physical symptoms.
Okay.
Things like increased heart rate, sweating, muscle tension.
Okay.
Their concentration becomes even more impaired.
Right.
And they might start to feel really overwhelmed or even have trouble sleeping.
So now it's starting to interfere a bit more significantly
Right.
with their daily life.
Exactly.
Okay, so what do we do then?
Well, at this point, we might need to employ more structured interventions.
Give us some examples of what that might look like.
Sure. So things like breaking down tasks into smaller, more manageable steps.
Okay.
Helping them prioritize, what needs to get done.
Yeah.
And teaching them some more advanced coping mechanisms like cognitive reframing technique.
Cognitive reframing. I feel like we might need a little deeper dive on that one. What exactly does that mean?
So cognitive reframing is a type of therapy that helps people challenge and change negative thought patterns.
Oh, okay.
Right? It's about recognizing those unhelpful thoughts
Right.
that are contributing to their anxiety and replacing them with more balanced and realistic ones.
So we're not just treating the symptoms at this point. We're starting to get into some basic therapeutic techniques as nurses.
Exactly. And it's important to remember too that, at this level of anxiety, validation is still so important.
Okay.
Letting the person know that their feelings are understandable
Yeah.
and that you're there to support them can make a huge difference.
Okay. So we've climbed a couple rungs on this ladder.
Yes, we
We've
have.
gone from mild to moderate anxiety.
Right.
And let's keep climbing. What happens when things escalate to severe anxiety? This is where things get really scary, right?
Severe anxiety can be incredibly debilitating.
Yeah.
You might see someone who's, trembling, dizzy, maybe even experiencing chest pain. Their speech might become really rapid or pressured.
Okay.
And their thoughts can be racing uncontrollably.
Oh, wow.
They might have difficulty communicating clearly and might even experience feelings of derealization or depersonalization.
Okay, derealization and depersonalization.
Yeah.
Those sound pretty intense. What do those terms mean?
So derealization is this feeling that the world around them isn't real.
Right.
They're watching everything through a fog.
Okay.
And depersonalization is a feeling of detachment from themselves.
Okay.
Like they're outside of their own body.
Wow.
So both of those can be incredibly disorienting and frightening.
Yeah, that makes sense. So what kind of interventions are we talking about at this level of anxiety?
Well, at this point, our priority is to create a safe and calming environment.
Okay.
We need to stay calm ourselves, use a reassuring tone of voice,
Right.
speak in simple, clear sentences.
Okay.
Sometimes just having that supportive presence can help ground them.
Yeah. I can see how our own demeanor as nurses can really make a difference in those moments.
Absolutely. We also need to be assessing for any underlying medical conditions that might be contributing to their anxiety, as well as any potential safety risks like suicidal thoughts or self-harming behaviors. Depending on the situation, we might need to consider medication to help manage the immediate crisis.
Cool.
But really our focus is on de-escalating the situation and helping them feel safe.
Right. And then we have the top of the ladder here, right? The
Right.
panic attacks. We talked about this briefly earlier, but can you paint a clear picture for our listeners of of what a full-blown panic attack looks like.
So imagine this sudden and overwhelming wave of fear.
Okay.
Right, that seemingly comes out of nowhere. Their heart is racing, they might feel like they can't breathe, and they're often convinced that they're having a heart attack or that they're dying.
Wow. Yeah.
And they might experience sweating, trembling, dizziness, even chest pain. It can be really, really terrifying.
Yeah, I can imagine. So what should nurses do, right, when someone is in the throes of a panic attack?
First and foremost, stay calm.
Easier said than done sometimes.
It is, but your calm presence can really help them to feel more grounded.
Okay.
Help them find a quiet space away from any crowds or stimulation. Encourage them to focus on their breathing.
Right.
Slow, deep breaths in and out.
Right. Like you could even model that for them.
Absolutely. You can model it for them. Sometimes just, putting a hand on their shoulder.
Right.
And saying, look at me, breathe with me.
Right.
That can really help to kind of bring them back down.
Now, what about medication? Would that be appropriate in a situation like that?
It can be. It really depends on the severity and the frequency of the panic attacks.
Okay.
As well as the individual's, overall health.
Right.
Sometimes a short-acting anti-anxiety medication like a benzodiazepine can be helpful to kind of break that cycle of panic.
Right.
But these medications should be used cautiously and under the guidance of a physician because they can be habit-forming.
Right. So it's not something to just throw at every panic attack. It's something that needs to be carefully considered.
Absolutely.
Okay, so recognizing those different levels of anxiety, it helps us tailor our approach. It helps us provide the most appropriate support. It's like having a roadmap to guide those interventions, right?
Exactly. And remember, it's not just about managing the symptoms. It's about helping the person understand their anxiety.
Right.
Develop coping mechanisms.
Yeah.
And ultimately regain a sense of control. And that's where, therapies like cognitive behavioral therapy or CBT can be incredibly helpful.
CBT. Okay. Tell us a little more about that.
So CBT is a type of therapy that focuses on identifying and changing the negative thought patterns and behaviors that contribute to anxiety.
Oh.
Right. So it's about teaching people practical skills to manage their anxiety.
Okay.
To challenge those distorted thinking patterns.
Right.
And to gradually face their fears.
So it's not just about, sitting on a couch and talking about their problems.
Right.
It's about really equipping them with tools.
It is, yeah.
To manage that anxiety in the long term.
Exactly. And the great thing about CBT is that it's often very effective. The skills that people learn in CBT, they can apply those skills to so many different situations throughout their lives.
Yeah, I can see why that would be so empowering.
It is.
For someone, struggling with anxiety.
Yeah, absolutely.
Okay, so we've covered stress and anxiety in depth. Let's shift gears and talk about another universal experience.
Right.
Loss. And the natural human response to loss. Grief.
Right. Grief, such a big one.
Yeah.
And it's such a complex emotion.
It is.
That can manifest in so many different ways.
Right.
It's not just sadness, right? It can also be anger, guilt, confusion, even relief.
Right.
Depending on the circumstances.
Yeah, and I think it's important to remember that there's no right way to grieve.
Absolutely not.
Everyone experiences it so differently.
Everyone does, yeah. And the source material mentions those classic stages of grief. Denial, anger, bargaining, depression, and acceptance.
Right, the Kubler-Ross model.
Yes. But it's really important to remember that those stages are not linear.
Right, it's not like you check off a box and move on to the next one.
Exactly. People don't neatly progress from one to the next. They might experience them out of order. They might revisit stages. They might get stuck in one for a while. It's a messy individual process.
It is a messy process.
And as nurses, we need to meet people where they are in their grief journey.
Okay, so how do we do that?
Yeah.
What are some key things nurses should keep in mind when they're supporting someone who's grieving?
Well, active listening is just essential.
Active listening.
Create that safe space for them to express their emotions without judgment.
Okay.
Don't try to fix their grief or offer platitudes like time heals all wounds.
Right.
Instead, acknowledge their pain.
Yeah.
Validate their feelings.
Right.
And just be present with them.
So it's about being a compassionate witness to their grief.
Yes.
Not trying to rush them through it or minimize their experience.
Exactly. And remember, Grief doesn't have a timeline. So be patient. Allow them to grieve at their own pace.
Now, sometimes grief can become complicated or unresolved,
It can.
leading to more serious mental health issues.
Right.
So how can nurses recognize when someone needs more specialized support?
Yeah.
What are the signs that maybe this isn't just normal grief, this is something more?
Well, if someone's grief is prolonged or
Yeah.
really intense or interfering with their ability to function in their daily life,
Yeah.
those are signs that they might need professional help.
Right. Yeah.
Look for red flags like, persistent sadness,
Okay.
withdrawal from others, difficulty concentrating, changes in sleep or appetite,
Right.
or thoughts of self-harm.
So again, we're back to being those detectives looking for those clues that tell us, okay, maybe this is something that requires more than just, our compassionate presence.
Exactly. And in those cases, we can play a vital role in connecting them
Yeah.
with mental health professionals who can, provide therapy, support groups, or other resources that can help them to navigate their grief in a healthy way.
This has been incredible. I mean, we've covered stress, we've covered anxiety, we've covered grief.
Yeah,
These are all, incredibly complex and really nuanced human experiences.
they are.
And I think, we've really just scratched the surface here.
We have. We've given a good overview.
But I feel like, we've laid a solid foundation for our listeners
I hope so.
to really understand, these different levels of anxiety, the importance of tailoring our interventions to each individual's, needs and experiences, and the essential role that nurses play in providing compassionate support during times of loss.
I think it's clear that understanding these concepts is just foundational
Absolutely.
for any nursing student, for any nurse.
And in the next part of our deep dive, we're gonna delve into those specific mental illnesses,
Okay.
right? Exploring, their symptoms, their causes, and the nursing care that they require. We'll also talk about some of the medications that are used to treat mental illness, building on what our special guest expert shared earlier. So stay tuned for part 3, where we'll continue this fascinating journey into the world of mental health. All right. Welcome back to the deep dive. In this final part, we're moving from those universal experiences of stress and loss that we talked about into the territory of specific mental illnesses.
Yeah, and this is where things get really interesting for you future nurses out there. We're going to try to untangle some of these common diagnoses, look at how they present, and most importantly, how you can provide effective and compassionate care.
All right. So where do we even begin with this massive landscape of mental illnesses? I mean, there's so much to cover.
Well, I think a good starting point is to kind of group them into categories.
Okay.
And the source material we're looking at, it focuses on mood disorders, anxiety disorders, and psychotic disorders.
Okay.
Which covers a lot of ground.
That makes sense. Okay, so let's start with mood disorders, where we're talking about conditions like major depressive disorder and bipolar disorder, right?
Yeah, exactly. These are disorders that involve significant disruptions in a person's mood.
Okay.
And then that impacts their thoughts, their feelings, their behaviors, pretty much every aspect of their life.
Yeah.
So let's take major depressive disorder as our first example. This is a condition that's characterized by, persistent feelings of sadness, hopelessness, a loss of interest in things that they used to enjoy.
So it's more than just, feeling down for a day or two.
Right.
We're talking about this pervasive sadness that can really, really drag on if it's left untreated.
Absolutely. And it can really impact their ability to function.
Yeah.
They might experience changes in their sleep patterns, their appetite, their energy levels. They might even have thoughts of death or suicide.
Right. So this is serious stuff.
It is. It is serious stuff. And nurses need to be incredibly vigilant in assessing these patients, not just for their physical health, but for their mental state as well.
What are some key things that nurses should be looking for, when they're interacting with someone who might be depressed?
Well, pay close attention to their nonverbal cues, right?
Okay.
Are they withdrawn? Are they making poor eye contact? Are they speaking slowly or softly? These can all be, subtle hints that something deeper is going on.
So it's almost like being a detective,
Right.
Looking for those subtle clues.
Exactly. And don't be afraid to ask direct questions
Okay.
about how they're feeling. If they've had thoughts of harming themselves or if they've experienced these symptoms before.
So creating that safe space
Right.
for them to open up,
Exactly.
even about those difficult topics.
Absolutely.
Okay. Now, in terms of treatment, I know that a combination of therapy and medication is often the most effective approach, right?
Right. Yeah. That's generally the gold standard.
Okay. And there are so many different types of antidepressants available.
There are.
I mean, we've got SSRIs, SNRIs, tricyclic antidepressants. It can get kind of confusing.
It can get confusing.
Can you break those down for us a little bit?
Sure.
I know our listeners are eager to understand these medications that they might encounter in their practice.
Absolutely. So SSRIs, or selective serotonin reuptake inhibitors, those are probably the most commonly prescribed antidepressants.
Okay.
And they work by increasing levels of serotonin in the brain.
Okay.
And serotonin is this neurotransmitter that plays a role in mood regulation. So some common SSRIs include fluoxetine, which is also known as Prozac,
Okay.
sertraline or Zoloft, and escitalopram or Lexapro.
Okay. So those are the big ones, the SSRIs. What about SNRIs? How are those different?
So SNRIs, or serotonin norepinephrine reuptake inhibitors,
Okay.
they work similarly to SSRIs, but they also increase levels of norepinephrine,
Okay.
which is another neurotransmitter that's involved in mood.
Okay. So it's kind of like a 2-for-1 deal.
It is, yeah. So venlafaxine, which is also known as Effexor,
Okay.
and duloxetine or Cymbalta are examples of SNRIs.
Okay. And finally, the tricyclic antidepressants. I know those are an older class of medications, but they're still used, right?
Yeah, they are. They're an older class, but they can be effective for some people. They work by affecting the balance of serotonin and norepinephrine in the brain.
Okay.
And so examples of tricyclics include amitriptyline or Elavil and imipramine or tufranil.
Okay.
Now, it's important to note that tricyclics tend to have more side effects than SSRIs or SNRIs, so that's something to keep in mind.
Yeah. So it sounds like nurses really play a crucial role in educating patients about these medications, monitoring their response, addressing any concerns that they might have.
Absolutely. It's all about empowering patients to be active participants in their own care.
Absolutely.
Right. And understanding the potential benefits and risks of each medication.
Okay, let's move on to another mood disorder here. Bipolar disorder.
Okay.
This one is characterized by extreme shifts in mood, isn't it?
It is, yeah. It's like riding a roller coaster of emotions.
A roller coaster of emotions.
They experience these periods of intense energy and euphoria,
Right.
which is known as mania.
Mania. Okay.
And then that's followed by, episodes of deep depression.
So it's not just like, feeling up or feeling down. It's these dramatic swings.
Yes.
Between those extremes.
Dramatic swings. Yeah, it can be really, really challenging.
What does that look like? Like what does a manic episode actually look like in a patient?
Well, during a manic episode, a person might experience, racing thoughts,
Okay.
a decreased need for sleep.
Okay.
They might be really impulsive.
Uh-huh.
They might even have grandiose delusions.
Grandiose delusions.
Yeah, where they believe that they have special powers or abilities.
Oh, wow.
And then, of course, they can crash into a depressive episode.
Right.
With all the symptoms that we discussed earlier.
Wow. That sounds incredibly challenging to manage, both for the individual who's experiencing it and for their loved ones who are trying to support them.
It can be really, really tough.
Yeah. So what are some like nursing interventions that come to mind when you think about, someone who's experiencing a manic episode?
Well, safety would be paramount.
Okay.
Right? If they're impulsive and have poor judgment,
Right.
they might engage in risky behaviors.
Yeah, absolutely.
So monitoring their actions and setting limits would be really crucial.
So creating that structured environment with clear boundaries can help kind of contain that manic energy.
Yes.
And prevent them from harming themselves or others.
Exactly.
Now, and of course, medication is a cornerstone of treatment for bipolar disorder, right?
Absolutely. Mood stabilizers like lithium
Okay.
are often prescribed to help regulate those mood swings.
Lithium, that's one we hear a lot about in relation to bipolar disorder. Can you tell us a little bit more about how lithium works?
Sure. So lithium is a very effective medication for managing both the manic and the depressive phases of bipolar disorder. And it's thought to work by influencing the balance of certain neurotransmitters in the brain.
Yeah.
But it does require careful monitoring because it can have side effects
Okay.
and it can interact with other medications.
So again, patient education is really, really vital here
It is.
to make sure that they understand, how to take the medication safely
Right.
and effectively.
Absolutely. Nurses need to teach patients about the importance of medication adherence.
Right.
The potential side effects, the early warning signs of relapse. It's all about equipping them with the knowledge and the tools to really manage their condition effectively.
Okay, so we've covered mood disorders.
Yeah.
Let's move on to another big category. Anxiety disorders.
Okay.
And I think we'd all know these are incredibly common,
They're very common.
affecting, millions and millions of people.
Millions.
And we talked about anxiety, as this normal human response to stress.
Yep.
But when does it cross the line into a disorder?
When it's persistent,
Okay.
excessive,
Okay.
and starts to interfere with their daily life.
Right. So it's not just, I'm feeling anxious about this presentation I have to give. It's that constant
Right.
underlying.
Yeah, it's like that anxiety dial
Yeah.
is just stuck on high,
Gotcha.
even when there's no real threat present.
Gotcha. And there are several types of anxiety disorders, right?
Yeah, there are. Each with its own kind of, unique flavor.
Right. So we've got generalized anxiety disorder,
Right.
where people are, they're worrying excessively about everyday things.
Yeah, they just feel constantly on edge, have a
Yeah.
difficulty relaxing.
Okay.
They might experience physical symptoms like muscle tension or fatigue or difficulty sleeping. It's like their worry muscle is just constantly flexed.
Yeah. Always on.
Always on. And then you have panic disorder, where people have those sudden and intense episodes of fear,
Right.
often accompanied by, those physical symptoms that mimic a heart attack.
Right. Which we explored in detail in the last segment.
Right. And then you have phobias,
Right.
which are, intense, irrational fears
Right.
of specific objects or situations like, spiders or heights or enclosed spaces.
Yeah. And those fears can be so debilitating
They can be.
that they really, restrict a person's life in a significant way.
Absolutely.
So how do nurses approach caring for someone with an anxiety disorder?
Well, first and foremost, validation is key.
Validation, okay.
Right. Their fears are very real to them,
Yeah.
even if they seem irrational from the outside.
Yeah.
Dismissing their fears will only make them feel worse.
Right. So acknowledge their feelings without judgment
Absolutely.
and provide reassurance that they're safe and they're supported.
Exactly. And then, depending on the type and the severity of the disorder,
Right.
treatment might involve therapy, medication, or a combination of both.
Okay. And we've talked about therapies like cognitive behavioral therapy, or CBT,
Right.
which helps people kind of challenge and change those negative thought patterns that fuel anxiety.
Right. CBT is a very effective treatment.
Yeah.
For anxiety disorders.
It's all about teaching people, practical skills
Right.
to manage their anxiety
Yeah,
and
yeah.
to gradually confront those fears.
It is.
And what about medications for anxiety? What are some of the options there?
So there are several types of medications that can be helpful. Antidepressants,
Okay.
particularly SSRIs and SNRIs. Those are often used to treat anxiety disorders as well because they can help to regulate mood
Okay.
and reduce anxiety symptoms.
So those same medications that we talked about for depression can also be effective for anxiety.
Yeah. The brain's complex.
Yeah.
Right. And these neurotransmitters, they play a role in both.
Right. Makes sense. Is there anything else besides antidepressants?
Another class of medications that are used for anxiety are benzodiazepines,
Okay.
like alprazolam, also known as Xanax, and lorazepam or Ativan. And these medications, they work very quickly
Okay.
to reduce anxiety symptoms, but they're generally prescribed for short-term use because of the risk of dependence.
Right. So it's finding the right medication,
Right.
the right dosage for each individual,
Exactly.
considering both, the benefits and the potential risks.
Absolutely. And it's important to remember, too, that medication is just one piece of the puzzle, right?
Right.
Therapy, lifestyle changes,
Right.
support systems,
Yeah.
those are all crucial components.
Absolutely. Okay. We've explored mood disorders and anxiety disorders. Let's venture into this realm of psychotic disorders. Okay.
Which are often misunderstood and stigmatized.
Yeah, they are.
Which can make it, even more challenging for people to seek help.
Absolutely.
So we're talking about conditions like schizophrenia,
Right.
where people experience this disconnect from reality.
A disconnect from reality. Yeah.
So this is a serious mental illness that
Yeah.
can really profoundly affect a person's, thoughts and feelings and behaviors.
Absolutely.
So what are some of the hallmark symptoms of schizophrenia?
Well, one of the most prominent features is psychosis.
Psychosis.
And psychosis involves experiencing hallucinations and delusions.
Okay, so break those down for us. What are hallucinations? What are delusions?
So hallucinations are sensory experiences
Yeah.
that occur without any external stimuli.
So hearing voices, seeing things that aren't there.
Exactly. Those are common hallucinations.
Delusions, on the other hand, are these fixed false beliefs
Okay.
that are firmly held,
Okay.
despite evidence to the contrary.
Right.
So, for example, someone might, believe that they're being followed by the government,
Okay.
or that they have special powers.
Right. Right. So it sounds incredibly frightening and isolating to experience those kinds of distortions in your reality.
It can be, yeah. Imagine not being able to, trust your own senses or to distinguish between what's real and what's not.
So how do nurses approach caring for someone with schizophrenia, knowing that they're operating from a very different reality?
Well, first and foremost, it's crucial to establish a trusting relationship
Okay.
and to communicate with empathy
Yeah.
and respect.
Yeah.
Remember, they're experiencing a very different reality than we are.
Right.
So don't argue with their delusions. Don't try to convince them that their hallucinations aren't real.
Right. Right. So meet them where they are, so to speak.
Exactly. Even if their reality seems illogical to us. Acknowledge their feelings and their experiences without judgment.
Okay. Okay, so what about treatment? I mean, medication is obviously a cornerstone of treatment for schizophrenia, right?
It is, yeah. Antipsychotic medications can really help to reduce the severity of symptoms like hallucinations and delusions.
Okay. And are there different types of antipsychotic medications?
Yes, there are. We touched on this briefly earlier, but there are two main categories. The typical antipsychotics,
Okay.
like haloperidol,
Okay.
and then the atypical antipsychotics,
Right.
like risperidone and olanzapine. And they work by targeting, different neurotransmitters in the brain.
Gotcha. What are some important things that nurses should consider, when they're administering these medications?
Well, monitoring for potential side effects is crucial.
Right.
The typical antipsychotics, they can cause these extrapyramidal symptoms,
Okay.
which are like tremors and muscle stiffness,
Yeah, okay.
which can be quite distressing for patients.
Yeah.
The atypical antipsychotics have a lower risk of these movement disorders, but they can cause other side effects like weight gain and metabolic changes.
Okay, so close observation and patient education
Yes.
are really key here.
Absolutely. Nurses play a vital role in educating patients about the benefits and risks of antipsychotic medications, helping them manage potential side effects, and encouraging medication adherence.
Right, and it's important to remember too that medication is just one piece of the puzzle.
Yeah, it's not a cure-all.
What other interventions are important for people with schizophrenia?
Well, therapy is essential.
Okay.
Psychoeducation
Okay.
can help patients and their families understand the illness and develop coping strategies.
Okay.
Social skills training can help to improve, communication and interpersonal interactions.
Uh-huh.
And supportive therapy can provide emotional support and encouragement.
So it's really this multifaceted approach.
It is.
addressing, both the biological and the psychosocial aspects
Yeah,
of the illness.
exactly. And nurses are really at the forefront of delivering that comprehensive care.
Yeah.
Working collaboratively with psychiatrists, social workers, and other members of the healthcare team.
Well, this has been a truly illuminating journey into the world of mental health.
It has.
We've explored the historical evolution of care. We've unpacked those essential concepts like the mental health continuum
Yeah.
and Maslow's hierarchy of needs. We've delved into those specific mental illnesses and really highlighted the crucial role that nurses play in providing, compassionate and effective care.
We've covered a lot of ground.
We have.
But remember, this is just the beginning of your journey as future mental health nurses. Keep learning, keep asking questions, and most importantly, keep that compassionate heart at the center of your practice.
Absolutely. You have the power to make a profound difference in the lives of people living with mental illness. And that concludes our deep dive into mental health. Thank you all so much for joining us.
Thank you.
And we wish you all the best in your nursing careers.
Best of luck out there.